All right, guys, let's talk about Chapter 7. This is blood and blood-forming organs and diseases. This is a really short chapter. I want to say maybe it's only 14 slides. So we should be able to get through this one relatively quickly also, although you guys can pause and come back to it, so that's kind of nice. All right, we're talking about anatomy and physiology of the blood and blood-forming systems. Let's talk a little bit about the functions of the blood. Our blood is designed to transport nutrients to our cells and then also to aid in the removal of waste from our body. So the average adult has 5 to 6 liters of circulating blood. You'd think it's a lot more than, or I would think it's a lot more than that, but especially when you consider how much someone can bleed. But if you really measure the amount of blood that people lose, like when they cut their finger or they, things like that, it's not quite as much as you think. It just looks like a lot. So for you visual learners, this is kind of what our blood is made up of. This is a test tube containing whole blood. You're going to have 45% of the volume is going to be formed elements, which is going to be those neutrophils, the thing that we talked about a couple of chapters ago with our immune response. And then the 55% of that is going to be our red blood cells, white blood cells, thrombocytes, which is our platelets. That's what helps us clot blood. So that's going to be the other 55%. Hemoglobin is in there. That's what oxygen is transported with hemoglobin. And these are your normal hemoglobin levels. I don't think that that's on your exam. I just put it out there so you guys would have a basic understanding of that. Leukocytes are what protect us from infection. We talked about that a little bit a few chapters ago. There's some normal counts for you, but normally leukocytes are what they look at when they're looking to see white blood cells. We also consider leukocytes white blood cells, and you're looking at that when you're trying to determine if somebody has an infection or not, and they'll usually get that when they draw your blood. Platelets, are also known as thrombocytes. This is important in blood clotting. There's your normal counts. And keep in mind that normal values can differ some, but platelets, people can have low platelets. And then if their platelets are low, that means that they're at risk for bleeding because their blood's not going to clot if they were to get hurt. Our blood-forming organs are the organs that help us form blood, because if you think about it, you are not born with the same amount of blood. You lose it over time, or you donate it, and your body can form more. And the organs that are used in that process are your lymph nodes, bone marrow, spleen, and your liver. And the lymph system is also what's protecting us against pathogens. Different tests that they're going to look at for this one are CBCs, that's complete blood count, with differential, that's going to tell them some of the neutrophils, eosinophils, white blood cell count, red blood cell count, those kinds of things. They're going to do a biopsy of some of those blood-forming organs. Back to those, the biopsy of some of those. Hematocrit is going to tell us kind of the amount of the stuff that's in our blood. Back to that first couple of slides. How much stuff is floating around in there. And the hemoglobin is just telling us the oxygen carrying potential of that, how much oxygen carrying potential your blood has. Disorders of the red blood cells, there are a few. You have anemia, which would decrease the oxygen carrying ability of your red blood cells. Symptoms of anemia would be pallor, which is just a whiteness to your skin. Your skin won't have that nice color. Fatigue, shortness of breath. Tachycardia is just going to be a rapid heartbeat. Headache, irritability, syncope, might be fainting. Iron deficiency anemia would be the loss of iron or inadequate intake of iron. There are many causes for this: blood loss or low dietary intake. And the treatment obviously is going to be to increase the intake of iron. That doesn't always work, but that's going to be what we try first. Folic acid deficiency anemia Folic acid is what we need to mature our red blood cells. So for them to grow and mature, we need folic acid. When we're deficient in this, it can be caused by a poor diet, overcooking our vegetables so that we don't get the nutrients out of them, and overconsumption of alcohol. Treatment would be to increase folic acid by eating green and yellow vegetables. Now, some people we're learning nowadays who have MTHFR, which is something that we'll get into, I believe, in a later chapter. Some people can't process folic acid the way that they should, and so they have to take a special supplement of a different type of folic acid. Pernicious anemia is the lack of B12, basically. They're not absorbing it the way that they should, and so they're going to get injections for the rest of their life. Hemolytic anemia is just the destruction of red blood cells, and this is very, very serious, and they're going to get their spleen taken out. This is a very serious form of anemia. Sickle cell anemia is hereditary. It is found in the African American race, and these cells are, instead of being that concave circle-looking shape, they're going to be shaped like sickles. And there is no cure for this. And essentially what happens is all those sickle-shaped cells can get jumbled up and cause clots and cause problems. Recently, the military, I don't know if it was just the Air Force, shut down all their PT tests because they had 2 or 3 people who passed away during their PT test, and they had sickle cell anemia. And so they've changed it up, and as long as those people are hydrated and things are going fine, then they can still test and be in, but they changed up everything based on sickle cell anemia. Mono, I wish I could have people raise their hand of who had mono. I did not when I was in school, but this is a virus, and it's a disorder of the white blood cells. And most people get fatigue, sore throat, swollen glands. And this used to be called the kissing disease. Leukemia is a malignant neoplasm or cancer of the blood-forming organs. If you go back to that slide before, it's cancer of those organs, and it's usually the abnormal production of immature leukocytes. So what that means is those leukocytes, which are white blood cells, can't really do anything until they're mature. So we have a bunch of little immature leukocytes or immature little kids running around who don't really know what to do, and therefore we can't fight off infection and we can't do what we need to do. It can be acute or chronic, and it affects people of all ages. Typically the acute form, though, affects children, and it can progress rapidly and it can be fatal. This is very, very sad. Now, I think that in this day and age, they've, gotten so many treatments that there aren't as many people dying from leukemia, but it used to be that people died from this quite often. They're going to have fatigue, headache, sore throat, shortness of breath. They might have bleeding from their mouth or their GI system, like in their stool. They're going to have bone and joint pain, enlarged lymph nodes, liver and spleen. All those blood-forming organs, again, are going to be enlarged, and they're going to have infections because, remember, our white blood cells are what help fight off infection. And so when we've got a bunch of immature ones running around that can't fight that infection off, we don't have enough of those grown ones that can actually figure out what to do. Excuse me, Hodgkin's disease is the most common type of lymphoma. They're going to have painless enlargement of the lymph nodes in their neck. They're going to lose weight. They're going to have a fever. And this average age of people who get this is 35. The cause is thought to be viral, isn't that interesting? And they make the diagnosis for this based on the Reed-Sternberg cells in the tissue. So they're going to do a biopsy, and they're going to check them, and they're going to see this cell, the specific cell in there, and that's how they're going to know. They're going to do radiation and chemotherapy, and if it's in remission of 5 years or more, they're saying a complete cure is possible. DIC, you guys don't really need to know a whole lot about this. this is an abnormal clotting following abnormal bleeding. This is caused by trauma. So complicated childbirth surgery, anything that you have that is traumatic to your body, you can have DIC from this. And it's essentially what this is they're going to bleed, and their coagulation up there at the top is that when your blood doesn't coagulate, that means it's not forming those clots. And so they're going to bleed, and they're going to bleed from different organs. They're going to bleed from their nose, mouth, ears, and it's not good. And it's very, very life-threatening and scary. All right, if you guys have any questions about that chapter, let me know. You can post them on our questions, the question part of our discussion boards and the modules, and we'll move on to the next chapter.